and I will be performing head-to-toe assessment. Head-to-toe assessment includes all the body systems, and the findings will inform the healthcare professional on the patient's overall condition. Any unusual findings should be followed up with a focused assessment specific to the affected body system. Before we start, we need to do hand hygiene. And I declare that the environment is safe, no risk for trips or falls. Close the curtains to provide privacy and maintain the dignity of the client. Dear student feedback, I'll be asking you a series of questions which it will help us for assessment of your current health status. How are you, ma'am? What is your full name? How do you want me to address you? Where do you live, ma'am? How old are you? Ma'am, I will ask for your health history. Do you have any medical problems? Do you ever receive medical care? How about receiving surgeries? Have you ever been hospitalized? So, in your family, did they have any health history like diabetes, high blood, heart disease, allergies? So, ma'am, thank you for your cooperation, and now we may proceed to your vital signs, including your temperature, blood pressure, respiratory rate, heart rate, weight, height, and oxygen saturation. Ma'am, may I know, do you know your weight? How about your height? Ma'am, I will tell you the reference. Could you please put it in your other arm? crucial for detecting injuries, monitoring neurological function, identifying infections, assessing developmental milestones, screening for chronic conditions, and promoting overall health. They help identify injuries, monitor neurological function, detect infections, and support growth and development in infants and children. Health assessments also help in identifying underlying health issues such as hypertension, diabetes, or thyroid disorders. Inspect the evenness of growth over the scalp. Inspect the hair thickness or thinness of the hair. Inspect hair texture and oiliness. In performing the assessment, we need to put the gloves on. So, Mom, I will start the head-to-toe assessment. May I ask permission to touch you, Mom? I'll start from the head. So, as I said earlier, inspect the head from the symmetry. Test your sensory function. So the test that I will do is sharp dull or sharp smooth test. Tell me if it is smooth or sharp or dull. So good. Okay. So sharp. So, Mom, I will palpate your temporal. I will palpate your temporal artery. Could you please open your mouth now? Close. Open. Close. Open. Close. Open. Close. So, Mom, I will palpate your temporal artery. Then I will auscultate you. After assessing the head, there are no lesions visible. Hair is black, thick, oily, and straight. Eyes, ears, nose, and mouth are in aligned position. Your cranial nerves are working well. Eye assessments are crucial for early detection of eye conditions, monitoring health, prescribing, identifying risk factors, ensuring safety, managing conditions like myopia, hyperopia, and astigmatism, preventing vision loss, ensuring children's development, and meeting safety standards. So, the next assessment is in the eyes. Inspect the eyebrows for hair distribution and alignment for skin quality and movement. Inspect the eyelashes for the evenness of distribution and direction of curl. Assess the visual acuity and determine the distance and near vision. Inspect and palpate the lacriminal gland. Inspect the cornea for clarity and texture. Ask the client to look straight ahead. Hold the pen light at an oblique angle to the eye, and move the light slowly across the corneal surface. Inspect the pupils for color, shape, and symmetry of size. Assess each pupil's direct and consensual reaction to light and accommodation. Assess the peripheral visual fields. Assess the 6 ocular movement to determine eye alignment and coordination.